You're listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emron, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
Thank you so much for joining me today on Simple Health Radio. I'm your host, Dr. Emron. On today's episode, we have a very special guest. He is a published author. His name is Dr. Michael Lewis. He wrote the book called When Brains Collide, which is a textbook about concussions and head injuries. He's also the founder of the Brain Health Education and Research Institute, and we are delighted to have Dr. Lewis on our episode today.
It's great to be with you.
Very good, sir. Dr. Lewis, tell us about your background. What specialty are you, and where are you practicing right now?
Well, I spent 31 and a half years in the Army. I'm a retired Army physician, and the last couple of years in the Army, I was involved in academics and research, and had the idea of if our brains made of fat, what if we used more fat to help those brains recover, particularly in our soldiers coming back from Iraq and Afghanistan? The short answer is it helps tremendously, and so in particular omega-3 type of fats. Retired about 6 years ago. Started the Brain Health Education and Research Institute, but I'm also in private practice in the Maryland suburbs of Washington, D.C.
Wonderful. Very good. Sounds like you have a very, very long and distinguished career. So we are, again, very delighted that you made time for us today. Now, I was looking through some chapters of your book, and there's a whole section about what a traumatic brain injury is. So can you tell our audience a little bit about what a concussion is and how a traumatic brain injury would be similar or different?
Well, the real short of that question is that a concussion is a traumatic brain injury. We just kind of soften the language because you tell somebody they've had a traumatic brain injury and all kinds of things go through their head. So we tell them, just like you used to say, you got your bell rung. So concussion is a traumatic brain injury. And so what is that? And so basically it's when the brain gets shaken inside the skull, whether it's a collision or it could even be a whiplash kind of injury, you can have the brain hits the inside of the skull, causes bruising, a contusion, and that's essentially what a concussion is. And most people think, okay, that's it. And well, that's actually just the beginning because that sets off all these biochemical cascades and inflammation. And if that's not brought under control, those symptoms, that inflammation can continue to burn and churn through the brain for days, weeks, months, years, even decades. When we talk about CTE and things like that, you think, Muhammad Ali, for example. So decades later, you can see where he went with his brain health.
Absolutely. No, I agree with that. And there was a section in your book about the incidence or the number of traumatic brain injuries and concussions each year, and the number was astounding. It's estimated that more than 4.5 million concussions occur every year just in the United States, and there's over a large portion of that will be in young people who are perfectly healthy.
Well, it's the young and the old are the two biggest risks as far as age. Young for very different, actually kind of similar reasons. But when kids are really little, of course, their head is much larger than their body and their musculature hasn't caught up to be able to support things. Plus, kids are daredevils. They're out riding bikes and skateboards and on the monkey bars and so on. The very old, very similar, not the head size, but the musculature. And so as we get elderly, we lose muscle mass and we lose that muscular coordination. Just like kids have trouble developing that and take time to develop it. And certainly, of course, kids are the ones that are out playing sports. There's estimated to be 44 to 45 million kids in the United States that play organized sports every single year. So, which is a good thing. We need them off of the couches. Obesity is a much bigger problem, actually. So we need kids off the couch and off the Xbox and outside playing and being active. So I actually look at it as a very positive thing.
Excellent. Very good. And then some of the symptoms of concussions, they can actually be very varied. They can be very straightforward or they can be very complex. So kind of walk us through some of the more common symptoms and then some of the more persistent and long-term symptoms.
Well, the common ones I think pretty much everybody recognizes. But one of the things is, to make a quick point, is you don't have to be knocked unconscious to have a concussion. So that's a big misnomer. And so really very few concussions are actually associated with a loss of consciousness. So you look at somebody and you think of the old Bugs Bunny cartoon with the stars twirling overhead. That's kind of pretty accurate, actually. And so some of the immediate effects may be loss of balance, loss of memory, just not quite feeling right, not being able to think through what they're doing at the time. And those are some of the immediate things. But my concern is more on the longer term effects. And so the memory issues can continue. Anxiety starts to pop up in pretty much all patients if they're suffering a month or two down the line or longer. Balance, of course, can be an issue. Headaches can be a big issue. It's a disrupt. So really, you think of a concussion or a brain injury as a disruption of the normal function of the brain due to that traumatic event.
Excellent. Very good. And thank you for breaking that down and explaining the fact that not everyone has to black out or be knocked unconscious for a concussion to occur. Oftentimes in the ER, when we see people, they're perfectly fine. They're walking and talking. It's almost like a delayed reaction, though. They may come in a few days later, the same patient, and now they feel horrible. They can't sit through the interview. The bright lights bother them. They have trouble just coming up with the answers to basic questions. And so I agree with you. I think there's that acute phase, then the subacute, and then the chronic phase as well. Very good. And then tell me a little bit about the supplements that you mentioned in your book. There's the CBD, which is derived from hemp, and also the omega-3 fatty acids as well.
Well, my original idea was, if the brain's made of fat, what if we use more fat to help the brain recover? Let's dump a load of the good fat there to help the brain put the pieces back together quicker. And so I started to explore it with the military and the idea of using higher than typical doses of omega-3 fats, which biggest reason why is, omega-3 fats are the most prominent fats in the brain, but they're also pro-resolving and anti-inflammatory. And what I mean by pro-resolving is they're helping resolve the inflammation. Omega-6 type of fats, which are much more ubiquitous in our diet, unfortunately, are very pro-inflammatory. You need inflammation when you have damage because that's how we start the healing process. But when we're out of balance between the omega-6s and omega-3s, you don't get the resolution that you should. And that's why I think that we're seeing more concussions and worse outcomes now than we were a couple of decades ago. That then ties in with CBD or cannabidiol from the hemp plant, which helps interact directly with our cannabinoid system that our bodies have that help keep that balance of inflammation as well as our brain health. And so the combination of the two for patients that I found have a tremendous value in helping them recover. It's nutrition. It's not a drug. It's not a cure, but it's helping set that nutritional foundation for the brain to heal.
Excellent. Very good. And thank you for explaining the differences and some of the ways that those chemical reactions would occur. Now tell us, if people, our listeners, wanted to connect with you, do you have a website or a phone number they can call in order to get more information?
Well, my nonprofit website is www.brainhealtheducation.org, brainhealtheducation.org, and lots of great information there. My practice website is braincare.center, not .com, but braincare.center. And like I said, I'm in private practice outside in the Maryland suburbs, just outside of D.C., in the shadows of the NIH and Walter Reed National Medical Center. And you can find When Brains Collide, the book that goes into a lot more detail about these subjects. You can find it on Amazon or whenbrainscollide.com.
Excellent. Very good. Thank you so much for that. And we'll have all these on our show notes and blogs. So people who are listening now can go to our website, simplehealthradio.com, and just click on those links and hopefully connect with you as well. Dr. Lewis, do you have some final thoughts or some ideas you want people to take away from our discussion today?
Yeah, I do. And it's one of those interesting things. I mean, our medical system is great at acute care and not particularly so good at chronic care. And so what we seem to have gotten away with, we do great with technology and we're always looking for that magic answer and that technological breakthrough, when really it all comes back to diet and exercise, good nutritional habits, and regular good exercise. And we seem to have forgotten that as a society.
Yes, sir. Very good. Those are wise words. I agree with you completely on that. And I'm hoping that the new research and so the new generation will recognize and respect that a little bit more. And I think head injuries, brain injuries, and a lot of other things that become chronic actually do have a major role in terms of how their lifestyle and everything that preceded that event, but definitely afterwards as well. So thank you so much for clarifying that. And again, I want to thank Dr. Michael Lewis. He's been our guest today. Thank you so much for making time again to speak with us about concussions.
Oh, my pleasure. And hopefully we've helped a few people out there today.
Excellent. Very good, sir. And you've been listening to Simple Health Radio. I'm your host, Dr. Emron. You can listen to us on simplehealthradio.com. We're also available on iTunes, Spreaker, Spotify, and the 3 and Out Radio Network. And I look forward to having you all on my future episode.
We hope you enjoyed this week's episode. Visit simplehealthradio.com to read the blog, follow links mentioned on this episode, and easily share content with your family and friends. Subscribe to the show on iTunes, Spotify, YouTube, Spreaker, iHeartRadio, and the 3 and Out Radio Network. Be sure to connect with Dr. Emron on Twitter, Facebook, Instagram, Pinterest, and Tumblr to send us your questions and ideas.